Hello friends, this is Dr. Shweta, currently pursuing geomorphology. So this video is about a very important topic and it's interesting also about the NEET PG allotment results. If we see NEET PG allotment result, they will always find that whatever maybe the people say that medicine is a branch which is saturated, but still maximum number of students that which can range as high up to 90% to 80 to 95% of the top 100 ranks they choose medicine. uh, so there is always a question about many people ask कि why do people choose basically medicine, why do they choose despite knowing the fact that medicine nowadays it is difficult it is almost essential to do a super specialty. So from what I have experienced, I will share the my experiences that why do people choose MD medicine and what are the why medicine has always been charming. So uh, to begin with, if we see our lifespan, then whether almost all of us, all or I will say maximum of us have become doctors by seeing the doctors around us who are giving us medicines and treating us. It's true that few people are also admire surgery people also, but in general we are more fascinated by medicine people because we come in normal contact with them every now and then. Even in our MBBS days, we are generally get inquiries about common diseases, the treatment, and the side effects, etc. So, in our subconscious mind, there is always a constant motivation that medicine is a very interesting path. Secondly, whenever we are reading in MBBS, when it is more of a book learning than practicals, when gradually when we come to clinicals and we go to wards, then medicine is generally more interesting because of the fact that we get quick results in the medicine. Like if for a new MBBS student who is first, second year or third year, even getting accreditations, uh, even on the in or auscultation, it gives us a uh, it is very fascinating. Even hepatomegaly, splenomegaly, diagnosing pleural effusion or auscultation percussions, DT, seeing deep tendon reflexes, etc. Give it gives us great pleasure. On the contrary, in the surgical branches, either surgical branches actually the student is generally in almost all medical colleges less exposed to surgical cases, and it is not on almost all students are in the only the history taking part in the MBBS only. Also, if it is a disease, then the reading of disease is easy in the medicine, and we whenever we club the whenever we club the clinical features and signs and symptoms, then and let us assume we have seen a case of the we have read about mitral stenosis and we go to ward and auscultate and get such a murmur, then will to give us great fascinator to diagnose such a case, and it's more thrilling. So basically we are more exposed towards the medicine disease throughout from even before joining to MBBS. Then the cycle also continues when we are in MBBS itself. Hence we are more inclined towards the MBBS, towards medicine in the MBBS itself. Now there are many people are there who are basically don't want surgical bandages. There can be many issues. First of all is that many people think that they can't tolerate such a long working hours. Moreover, many people think that it's doubt that capacity that whether they will be able to do good surgery or not. And few people are like this, few have tremors, few have some difficulty in the eyes. So say say that there are some set of people who try to who always want medicinal branch. Now the catch here is that if you ask a surgical if you ask a surgical person, then he it was not like that he was loving surgery more than medicine. It was like he loved both medicine and surgery, but he used to like surgery more than medicine. But if you ask the same question to a person who loves medicine, then you'll get such a set of people who only want medicine. I mean, they don't love surgery at all. So a person who is aiming for MS general surgery, let us assume, or MS orthopedics, if he will get a good rank, then there are quite high chances that he will land up taking MD medicine. But if a person get who loves surgery, despite who loves medicine, despite the chance of getting surgery, even if he gets I mean despite having the scope of taking surgery, he will take MD medicine also. I think I fumble up. Basically what I want to say is the person who is doing surgery, he also loves medicine, so he can also take medicine if he gets good rank. But if a person who loves but there are set of people who will never take surgery at all. Now the last part, that why do people have started taking why despite the competition of need super specialty, why are people taking medicine? The thing is that if you see the trend from the last 20 to 25 years which I have seen, it was always that medicine was taken at early rank. Just there was a phase of 5 to 10 years in between, I will say between 2005 to 2015, in which suddenly people started taking pediatrics, radiodiagnosis, and orthopedics bit more. The reason was that the seats of the surgery, seats of need super specialty were relatively very less. But from the past 5 to 7 years, the seats of need super specialty in the medical branch has increased in in large amount. So every person who enters MD medicine, he knows from the day of life, day of joining one, that he is going to take, he has to do super specialty. And since the seats have increased, so he is also confident that if he will that if he will prepare well, then he will get medicine easily, super specialty in medicine easily. So these all are points in which due to which I think that people and toppers are taking medicine more frequently than that of the radiology or other branches which were being taken previously. So overall, if we combine it all, then toppers take medicine more frequently to the region because they were always taking medicine. People always medicine was his preferred choice. Moreover, due to the fact that we are more exposed to medicine throughout our throughout our MBBS journey and even before that, and due to increase in number of seats of the super specialty, and as such, medicine we are more exposed to medicine as compared to other surgical branches. Thank you.